Slim down by knocking off the extra inches in a matter of minutes.
That's right. Dr. Robert DeVincentis, or Dr. D, as patients and friends like to call him, says i-Lipo may be a great option for you. He also brought along Kelly Blitz. She's had success with i-Lipo, and good to see you guys.
Good to see you.
All right, well, let's talk out there for those who haven't heard about it and haven't watched us talk to you. i-Lipo, what is it?
Yeah, it's amazing new laser technology, okay? It's state of the art. Basically, it's FDA approved as a Class 2 device. It's an alternative to liposuction. So there's no pain, there's no cutting. It's an external procedure, outpatient. It's done in 20 minutes, okay? 42 laser diodes are placed over a stubborn area of body fat. The lasers will penetrate the skin without harming the skin and hit the target fat cells. Once they hit the fat cells, the cell walls open up, they release their contents, therefore shrinking the fat cells. Now the contents go into the bloodstream afterwards, so we exercise afterwards to burn off the calories that were just released from that stubborn fat cell.
Gotcha, makes sense. Now, Kelly, you have had a treatment since the last time that we saw you. So tell us a little bit about your journey and how many pounds and inches you've lost.
So every treatment that I have experienced in every area that they measure, it's been a total of over 2 inches lost.
Each time?
Yeah.
Wow.
It's measured in different areas, but
Yeah.
a total of 2 inches over every time.
And now we were talking also, I mean, you can't just do this and expect it to be done with. So talk a little bit about what you do day to day to make sure you keep those results.
Well, of course, you have to maintain a healthy diet, but right after the treatment, you make sure that you burn at least 300 calories. So I just go work out immediately after. Like Dr. D said, it's excreted, and then it's amazing.
Wow.
Yeah.
One of the advantages of your location there, right next to the gym, right?
Exactly. Yeah, we have a gym next door, and that's usually included with the treatment, so you can go right next door and be able to burn off the calories that's been released from those fat cells. So you see the before and afters here. We've had just some amazing results.
Wow.
Those are real patients in our office. The first patient lost in 8 treatments, 17 inches. It's been incredible. I mean, life-changing. It sounds too good to be true, but that's why I invite customers to come try it. It's amazing. I've been in the fitness industry over 30 years. I've seen all the gimmicks out there. You've got to be careful. FDA approval is huge, and the fact that this is non-invasive, and the pictures speak for themselves. You can see this patient, she's lost 30 inches in the 8 treatments. So it almost looks fake, but it's real. It's been amazing. So
yeah, and one of the things people will always want to know, FDA approved lets people know that somebody has checked it out and it works, but safety, they also check that.
Yeah, and I overstate that sometimes because I'm all about safety. There's nothing invasive about this, and that's the biggest thing. There's no side effects, no downtime, no cutting, no pain, no anything. There are a few patients, like if you have epilepsy or a pacemaker, you can't do the procedure, but most patients can. And then the efficacy is big. It took over 10 years for them to get the FDA approval. It's been done in Europe for over 12 years. So, and the FDA is pretty stringent. If they're going to say something works, they want to see the long-term results, and they've got it. So it's been amazing. So.
Now, Kelly, you mentioned after a treatment you just zip right over to the gym. So how quick and how long does it take for this to happen?
So you have 2 hours after the treatment where the fatty acid glycerol is circulating your blood to burn it off permanently. So basically you're mobilizing the fat that's in those stubborn areas. You know how when you lose weight, you lose everywhere else except for those stubborn areas.
What you want,
So now with this technology, you can actually target a stubborn area to lose from. We want to keep the fat in our face and lose it everywhere else, pretty much. And that's what's been amazing with this. And without cutting, without any scarring, and it's smooth afterwards. The skin actually tightens up. It's really amazing. So.
Wow.
All right, we always like to give our viewers special offers. What do you got?
Yeah, again, I really want people to try this. So the first 15 callers that call in after this and mention the show will get their first treatment for $59. So they get 1 treatment of i-Lipo for $59 and no gimmicks. I really want you to try it, and experience it at a low cost.
Numbers on your screen right there. You can see it.
Yep.
Appreciate your time.
Yeah, you bet. Thank you.
Congratulations. Thanks for sharing your story.
Thank you.
And we'll post this information on our website a little later. Just visit First Coast